Morning, everyone. Oh, yes, it's okay. It's being recorded. Okay, there we go. So, good morning. So, I thought today we would chat a little bit about the impact and clinical implications of a parent who is experiencing a serious mental health condition, and then we'll highlight specifically some things that are related to psychosis. So I think one of the things to highlight is that, there isn't a ton of research on the best practices out for parenting interventions when a parent has serious mental health issues. But there is some evidence out there that talks about the benefits that to parents when an adult mental health provider provides them with some support, resources, discussions related to parenting. So I thought this would be a good topic. And sometimes, as adult mental health service providers, we're not that comfortable, or it doesn't come right to mind about discussing parenting and parenting practices when we're primarily adult serving population. So I thought today we'd talk a little bit about the challenges in parenting, the potential impact of having a serious mental health condition on parenting and on the children, and identifying some clinical implications. So those things that, those of us who are adult providers can do. So, when we're working with individuals, it really is a disservice to that client to not to understand their family system. Whenever possible, having these discussions to whatever extent possible that they're willing to share. I think everyone knows that parenthood can be overwhelming, and this is, an opportunity to talk about, the struggles and the satisfaction that on parenting and relationships with the children as part of the treatment plan. And these individuals may require additional and unique supports in order to be able to reach that full parenting potential. And that's not so dissimilar. We offer additional supports for finding employment and maintaining employment. And so if we think about it in that same vein, it's offering these additional supports related to parenting. So, number of children impacted when a parent has a mental health condition. I just thought that, just to give us a scope of how common this might be occurring in our day-to-day practices. So, about 38 to 44% of people with schizophrenia or schizoaffective disorder have children. Women with serious mental health condition have children at the same rate or at higher rates than the normative population, those without a mental health condition. More women with schizophrenia have children than men with schizophrenia as well. So we also know that about, up to a quarter of children worldwide live with at least one parent with a mental health condition, and up to 55% of children that have a parent, at least one parent with a serious mental health issue, develop a mental health condition themselves. So this puts them at 2.5 times more risk because they both have the genetic and contextual risk factors. So it's pretty substantial impact that we have the opportunity to make here when we start addressing this in our practice. So effective parenting, when we think about it, it really involves a lot of structure, being able to share information at developmentally appropriate levels with the children, receiving feedback. It requires some goal-oriented behaviors, being strategic and how they navigate parenthood. And these are some of the things that we know, especially with psychosis, but with any serious mental health condition, these are the kinds of things that are impacted for the individuals with whom we work. So, and it also requires us to consider, another human being's physical needs, emotional needs, developmental needs, psychological needs. And that's a lot of pressure for anyone. Layered with a serious mental health condition, it can be really, really difficult. And so the more supports, the better. Specifically related to psychosis, many of the individuals diagnosed with psychotic disorders have difficulties in understanding other people's mental states, their feelings, the intentions of others. So that perspective taking ability is impaired. And that's something that's really critical in parenting. It also obviously causes disturbances in how they think, their feelings, their behaviors, and this can cause struggles in navigating the parenting role. Parental psychosis is a risk factor to a child's well-being. And so this is, really nice space for us to not only impact the individual sitting in front of us, but to have sort of that carryover effect to their child and to their family system. But all domains of parenting are potentially impacted by psychosis. So really evaluating and assessing where the needs lie and the additional supports lie for the individuals, because parents might be experiencing depression, fatigue, having difficulty focusing, impaired ability to provide protection, or making sure their child is safe. They have some difficulties maintaining routines of the child. And there are oftentimes these absences, either mental absences or physical absences, where they may be hospitalized. And so this can lead to insecure attachments with their children, because they just don't know where the parent is going to physically be or how available emotionally they will be, or mentally. So mental health conditions can really impact an individual's capacity to parent. They might not be able to communicate and play in the ways in which they would desire, either because of symptom severity or medications, or they're having trouble focusing. So it can really impact a lot of the capacity to parent. Their parenting style is often impacted as well. So they might be on the more permissive side, so that, I let the child do whatever they want. The child is my equal. We're not on a hierarchy, because I want to avoid any kind of pushback, any kind of disagreements. It's just easier to be very open as a parent, very permissive as a parent, to avoid any kind of emotional responses from the child or from the parent if they're not sure how they might respond. Or it may result in a parent being overly restrictive. And I think this one happens more often than we realize. So if an individual has, a delusional belief system, they may become very restrictive of what the child is allowed to do or what the child's allowed to engage in, for fears of their own internal responses. Paranoia, things like that, is really limiting to the child because they think that they are protecting their young one. And then the quality also of these interactions can really be impacted, and there's where we were talking about the protecting from internal threats. And this can be unpredictable for a child, very confusing, and it might limit them developmentally because they're not able to do the same things that their age-appropriate peers are doing. Parents' emotional availability might be impacted, that emotional engagement, the ability to empathize, perspective taking, and then those practical aspects of parenting. If they're not physically there because they're hospitalized, how do they provide the child with feelings of safety if they feel unsafe themselves? How are they able to get the child on time to school, to the bus, to doctor's appointments if this is something that they struggle with themselves? The level of individual functioning of the child is also impacted, and their interpersonal functioning. And we'll talk about that in a couple more slides. They're more likely to become the parent's carers, which, although can be a way for the child to build resilience and self-worth and understand the importance of giving back to others, but it can also feel very burdensome to a young one. And then it can impact, obviously, overall general family functioning. Difficulties are like poverty, low social support, substance abuse, trauma, homelessness, all those things that we know often come along with serious mental health conditions, especially psychosis. Those really disproportionately impact individuals with serious mental health conditions, notably women, in these situations. And these social adversities due to their symptoms, like, resulting unemployment, financial problems, housing, all of these different kinds of things, really increase the likelihood that the child is also going to experience some social adversity. If a parent is experiencing odd behaviors and beliefs, and the child is subject to those things, a part of those things, observing those things, this can really lead to unusual social and behavioral expressions in children. And obviously, that impacts how they operate and how they function and navigate their, age appropriate or peer context. So that can be a real struggle for children. They can experience cognitive, emotional, behavioral difficulties. They can experience mental health problems as a child or even into adulthood. But not to say that there aren't positive impacts to parenting for individuals. So on the parent side, it really can give them a sense of pride, a sense of purpose and meaning. It allows them sometimes to maintain motivation, if not for themselves to engage in treatment and follow through with treatment, but for their child. Mothers specifically, we see that having children and having that relationship will improve their self-esteem. It helps them to stop substance use. They're better able and equipped to handle their own psychiatric concerns. And for children, when they have a parent with a mental health condition, they are able to develop more resilience, especially when they're surrounded by additional supports in their network. They are typically more independent, selfless. They're more connected to a larger support system than other children may be, and they have really amazing coping strategies that they've learned along the way to navigate. And one of those things is sort of the positive reappraisal or reframing of how they see their situation. So what can we do with all of this? So if we're adult serving agencies or adult mental health providers, I think step one is really identifying the individuals who have children living with them. Parenthood can really have a lot of emotional importance for individuals. It's part of their identity, their life, their goals, their plans. And so addressing this area with them on an ongoing basis is critically important. Parents, the literature talks often about how parents would like greater acknowledgement from those of us who provide, adult specific services regarding their parenting concerns, and also support related to those concerns. So resources, support, education, all of these different kinds of things, skills that they can practice that then they can take home and use with their children. So however, a lot of these needs are not being met in adult services. One thing we do know is that parents may be a bit hesitant to seek out psychiatric services at all if they have children, but especially may be fearful of bringing it up in sessions because they have this fear of negative consequences, like losing access to that child, losing custody of the child. If there's previous history of separation or reunification or custody, this is a very delicate topic. So they may not be quite ready to open up. Just something to keep in mind. And individuals, if they feel inadequate in their parenting abilities, or if they're struggling with their relationship with their child, their self-esteem, quality of life, stress levels are all impacted. So we can see how this impacts the work that we do on that individual level with someone. And so targeting interventions that are aimed at the child, the parent, and the system are really important. Including discussions about how to improve parent-child interactions is a key thing to consider when you're thinking about what you would address. Talking about the child's emotional needs and the consequences if these needs are unmet. Talking about the coping skills of the parents, because this is, excellent modeling behavior for the children. And we know that when the parent has healthier coping strategies, that this teaches the children how to manage stress and self-regulate. So those are important, obviously, skills for a child to be learning from their parents. Talking about how to explain their mental health diagnosis to that child in a developmentally appropriate way. So they need to understand child development. They need to understand those stages. Children really worry, and it causes a lot of anxiety for children if they don't understand what's happening with their parent. And so making sure the parent is equipped to understand, how do you talk to a toddler versus a 4-year-old versus an 8-year-old. And parents, they may overshare. They may not provide sufficient guidance. They might avoid the conversation altogether, or they may give inappropriate information to that child's age if they're not sure what to address, how to address it. And so there is my favorite resource for this is out of Australia. It's the Children of Parents with Mental Illness. I included it here, and it's at the end of the presentation. They offer a wealth of materials for providers to use, for parents to use, that gives you ideas about developmentally appropriate ways to have conversations about different things. They give you some scripted ways to use it. And I just have to shout out to our very own Dr. Harry Civic, who has a paper on there that they cited him when he was discussing about children, their response to a parent being hospitalized and what their needs are when a parent is hospitalized. So Harry, way back when, had so he is still on their website today. So that was a really exciting find for me. But yes, certainly check out the Cope Me website, because I can't tell you what a wonderful resource. I can't speak about it enough. And it's something that you can use in session with the parent, and that they have the ability to take home to use with their children. Talking with them about behavior management strategies, boundaries, how to maintain routines, not only for themselves, but also for their child, and then planning in advance if there's a potential resource, or relapse, where symptoms might get in the way of their ability to parent. And it might be completing something like the Wellness Recovery Action Plan, things like that, the tools that you can use to help them think through where their children might be impacted and what's the safety net or the backup plan, which can decrease a lot of anxiety for the parent as well as the child and the people around them that are there to step in and be supportive. Connecting them with all kinds of resources, housing, financial management, connecting them with larger social networks, or incorporating their own family systems in a more planful way and informed way. Talking with the parent with whom you're working about their negative and depressive symptoms, and feelings that they may have related to inadequacy, guilt, shame, fear, grief, all of those things that I think all parents struggle with, but making sure to highlight that. And there is this potential that, symptoms are not the only thing that could be impacting their ability to parent and the quality of parenting, but medication side effects could also be impacting that. And so having an open discussion related to that. They also have this desire for support, education, skills, support, resources. This is something that has been cited consistently in the literature. Some of the highlights that keep popping up are understanding their child's developmental stage, effective parenting practice, perspective at taking ability, and how they view themselves as a potential role model for their child. Do they feel that they're an adequate role model? Family peers, this is a wonderful opportunity for them to be involved and to provide some coaching in different areas, or some support with like schools, or if CPS is involved, and also group work. So having fellow family members together, learning some of these skills and relying on each other. So this is really an opportunity for us to provide parents with a serious mental health condition, especially psychosis, to be able to really fulfill their parenting responsibilities to their fullest potential. And I think, if they understand that their provider is really supporting this and wanting to support them as they make some adjustments to their parenting style, quality of parenting, can really go a long way with these individuals. So obviously, whenever possible and appropriate, making sure that their extended family, whomever that might be, are involved with you in session. If they're involved in the child care or child rearing, they could really benefit from support, education, and resources as well. But also, we know a lot of these children are really helping to support the parent. So by involving a larger family system, it can unburden the child from some of that role. So these are some of my favorite resources. Again, Cope Me, SAMHSA has some good resources. And if you think that somebody would benefit from a more structured, formalized parenting program, they have adapted the CBTp positive parenting program for adults with mental health conditions. And so it's also an excellent resource. And if you're not a provider of it, there are providers all over. So you can find them there. So thank you for listening and taking the time. If there are any questions, I think we might have a minute or two.